Welcome back to Get Healthy with Dr. Cooper. In our show today, I'm having a candid talk with Dr. Bryce. Dr. Bryce has dedicated most of his life to treating patients with chronic diseases. He, of course, is a regular doctor. What I mean is an internal medicine doctor that practices in Dallas, but he does counsel a lot in lifestyle medicine. Dr. Bryce, welcome again to Get Healthy.
Thank you so much.
Very good. So before the show, we were discussing that you and I have patients who we have taken through lifestyle medicine, that they've done well, but they have some problem maintaining the change. Now, I remember you talking about a patient of yours who had a particular disease in which her skin was hardened. And after you have met with her, resolved the cause of the disease, she did well, and then she relapses. Why don't you give us that story?
Her name is Monica. Monica, very fascinating patient. She came to me, she had systemic sclerosis, where she could not walk. Her heart was functioning at about 15% of what it should, how it should function. And Monica came to our function, and she went to a lifestyle change where she changed her diet completely. No meat, no artificial foods, no chips, for about 6 weeks. And halfway through the program, Monica shocked all of us. She came every night with in a wheelchair. Monica walked in.
Imagine that.
And we were surprised. Not only that, there was significant changes in her skin.
So she walked in after a couple of weeks on the now whole food plant-based nutrition, correct?
That's correct.
All righty.
Okay. Her skin was plastic, hard. Her face was like a plastic jug.
Imagine that.
And within 3 weeks, you could see the marked change. At 6 weeks, everybody was shocked. To tell you the truth, I was shocked myself.
Of course, I would be shocked myself.
I did not expect that dramatic
Change
results.
in such a short time.
Right. And so she was one of the individuals that really opened my eyes to the power of the body to heal itself. God put mechanisms within our body so that we can heal if we put our body into the right environment, the proper food, rest, proper thinking, drinking water that's pure. There's
It's
amazing results.
Natural remedies.
Right.
Did you know, Dr. Bryce, that studies have shown that 66% of people that live in our world today live in an area in which they will die as a result of lifestyle diseases?
Yes.
66%. Not acute diseases, but lifestyle.
Premature death, unnecessary death, it's prevalent, and it can be
resolved.
We don't have to die from these conditions.
You know, even cancer. A study was done, or I read a report recently, that the rate of cancer in South Texas, all type cancer in South Texas, has increased as a result of obesity. So we're actually eating ourselves to death.
Yes.
I have a story similar to that of Monica. So a patient of mine, he was about 65. He came into my office with depression, arthritis. He was significantly overweight. He also had high blood pressure. So I discussed with him lifestyle changes, diet, exercise, stress management. He opted to do the lifestyle changes. He didn't want the drugs. He lost about 70 pounds, got off his high blood pressure medication. His arthritis now resolved, and his depression was improved. But sad, after about 2 years, I didn't see him for a year because he was doing so well. Then he came back having gained some of the weight. So Dr. Bryce, we know that lifestyle medicine is actually the vaccine for chronic diseases. Chronic diseases like diabetes and hypertension, heart disease, we can actually cure, improve with lifestyle medicine.
Right.
But we have a problem. And the problem, how do we encourage our patient to continue with the change?
Well, Monica taught me something. After that 6 weeks, maybe up to about 3 months, Monica made a video for me. She gave me permission to tell her story. It's just such a fantastic story. But Monica went back to eating how she ate before. Her problem was chips. She used to have a bag of chips, and she'd have a bag of chips every day.
Wow.
And Monica went back to eating her chips, lots of fatty meats, and everything that put her in trouble before. She recognized the change. She went back to it. And I started looking at what is it that would pull Monica back into this. And I realized a lot of it is our trauma or brokenness. And that we're actually medicating ourselves with food.
That's true.
Or the lifestyle that are hurting us. These are actually drugs. So you can have food for healing, or you can have food as a drug. And helping individuals go through this process.
You could also have food as a disease-causing agent.
Yes.
So food can cause diseases, food can heal, and food can be a drug.
That's when food is a drug, then it causes disease.
Okay,
And
good point.
this is the big problem is, how do we help these individuals to not go back to their former lifestyle? And this is what I think we're missing in medicine, that we don't recognize the trauma and the reasons why people are having to quiet this inner storm that's in. And we must find a way to do this. We must address this. And that's what I missed in Monica. And it opened my eyes to a new world. And once I start addressing this issue, my success rate improved significantly.
Good. I know we have a lot of viewers watching us with the same problem. They have lost weight, they have regained it, they've controlled their sugar, they changed their lifestyle, but they have fallen. Can you tell me, what did you discover? How can we calm, or patient calm the problems, or the viewers? What do we need to do to stick to the change? Tell me.
See, we have the upper brain called the frontal cortex, or the frontal lobe. And this is supposed to override the lower brain, or the limbic system, the emotional center, the primal drives, where you have the hypothalamus, the amygdala, and here we have memory and program setting.
Okay.
So people who are traumatized, especially before the age of 18, they get into a situation where they are placed in what we call a dysfunctional, dysregulated amygdala setting. And here, this limbic system becomes so hyperactive that it overrides the logical thinking. And so people decide, well, I'm not going to eat donuts anymore. It's empty calories, it's white flour and sugar.
A lot of oil.
A lot of oil, which is actually not good food for me. You make that decision, you step out of your house, and you're passing this donut store, and you turn right into it, and you order 24 donuts.
Because the lower brain is controlling the upper brain, right?
Exactly.
Okay. All right. Now, where do we find, Dr. Bryce, the upper brain? Where is that? Is that the cortex? Where is it?
This is pretty much right here.
Right at the front.
The frontal cortex, that's our logical thinking. And there are a number of things we can do to override this effect. One of which is you have to make a resolute decision. Okay, a lot of people want to lose weight. They want to be healthy, but they're really not making that all-important decision
to get this done.
To get this done.
All right.
And that is crucial. One of my patients, I was on him every single day to quit smoking, and he just would not budge until he brought his father to see me. His father was coughing up blood, and took an x-ray, and there was a big mass in his lung.
Imagine that.
2 weeks later, the same patient quit smoking.
Of course. Because now he was forced that if he didn't quit,
He made a decision to be. So this is where goal setting, making a decision that I am going to do it.
you know, Dr. Bryce, I have patients, those that I have to counsel for 3 months to make the change, those that I don't counsel at all or just one sitting. I will tell you the story. So a drug rep came into my office several months ago and he said, "Hey, Dr. Cooper, I lost 35 pounds. I said, "How did you do that?" He said, "You know, I picked up your book and that's where it began." No, I didn't speak with that person at all. But he got the information and he made the change. So now the upper brain was controlling the lower brain, the habits, right?
Right.
And that's what we want to point out, that first of all, you must believe. You must believe, then you must change, and then live.
Right.
You know, so if you're watching us right now and you've had a problem with weight, high blood pressure, diabetes, you have been with your doctor or you've watched the show and we have explained to you that whole food plant-based nutrition is fantastic for you. I didn't ask you anything about yourself, where you practice and how long have you been practicing. Tell me about yourself.
Well, I'm in the Dallas-Fort Worth area. I'm an internal medicine specialist, and I've been having the privilege of having a few thousand patients that we've been having a lot of fun together.
Nice.
And we've been doing this now for about 30 years.
I know, and I know you're a very special doctor because you have combined into your practice lifestyle medicine with your traditional conventional medicine, and that takes a lot of time and love and dedication. Not only that, but you go to various churches and community groups to discuss lifestyle changes. Am I right?
In my practice, you have evidence-based medicine. We have a lot of positive psychology, and we also have spirituality.
Amen. I
We
love that.
bring the whole picture to help individuals.
The whole patient approach,
Right.
holistic medicine, because we know that health is not only the absence of physical disease,
Right.
am I right?
Yes.
But we must address social, emotional, and the spiritual aspect of the patient.
That's correct.
So, Dr. Bright, we just left the show and we were discussing how to make the change work. Tell me about that.
We mentioned that a lot of the problem that we're having is the what we call the brokenness or the trauma that individuals have, PTSD, the adult childhood experiences, divorces,
Dysfunctional
dysfunctional families, the
abuse as a
abandonment,
child,
abuse.
yes.
All of these different issues, they create a high overactive amygdala. And this overactive amygdala puts us in a very uncomfortable state. And we do a number of things to try to get some comfort. And unfortunately for some people, it's inactivity. It is
Comfort food.
comfort food,
Drugs.
as they call it, drugs. And fear, shame are primal drives that we get into this issue. Interestingly, the Navy SEALs pulled in a number of neuroscientists to try to address some of these issues where a number of the Navy SEALs were failing. And they presented 4 steps for critical change. One was goal setting, that all-important decision, mental rehearsal, self-talk, and arousal control, which is essentially deep breathing. Okay, and you can break this down for your practice for individuals. So we did mention the all-important thing about decision, making that all-important decision that I am going to do it. Making that decision empowers the frontal cortex, the part that overrides the lower brain to achieve your goal. The second step is mental rehearsal. So you want to write down the things you're going to do, how you're going to do them, and you want to rehearse this. In the Bible, they actually recommend morning, noon, and night that you rehearse these principles, rehearse God's word. It is here that the frontal lobe becomes empowered, okay? But whatever principles you want to do, and then you have self-talk. We say up to 300 to 1,000 words a minute talking to ourselves, and most of this is negative thoughts. We mirror this negativity that the world is bringing on us, and we keep saying these negative thoughts. What if we change that with positive thoughts? So you have your goal setting, and you decide that you're going to lose 20 pounds, and then a donut decides, no, you're not. You need to start talking to that donut, positive thoughts. You need to rehearse what you're going to do when you face a donut. So you have these mental rehearsal, going over the drills on a regular basis, and then self-talk. Then you have arousal control. With arousal control, when you take very slow, very silent, very deep breaths, when you actually do this, the amygdala turns off the cortisol drive and the adrenaline drive. But it's a very weak drive. The big ones are really the first three: the decision making, the mental rehearsal, as well as the self-talk, especially the self-talk. And let me not forget to tell you, one of the most important things is support. You need to partner with someone. You need to be a part of a group, partnering with your husband, a friend. You have somebody, you decide to exercise, and you have somebody who's going to knock your door at 5 o'clock every morning. Whether you want to or not, it makes a big difference in the support system.
So I'm going to rehearse what you just said, because I think you have listed valuable information. So in anything in life, whether it's financial success, health, or relationship, you must have a goal. You must have a plan. So you're going to have a goal. It could be a big goal, but the goal has to be big enough to move you. That's what someone said. And then with this goal, you're going to have mini goals. You're going to break that up into pieces. These goals should be tangible and measurable. You should keep yourself accountable for these goals you're setting. And then, of course, you said to positively think about these goals and rehearse that. Allow that to become a habit. If this is a habit, then you're going to be practicing this on a daily basis. Alrighty? And then you need to find a way to say no to the negative thoughts. So when the donut comes in your way and say, eat me, you're going to say, no, you have too much processed sugar, white flour, and oil. I'm not going to eat you. So you positively rehearse, and you must take action. Then, of course, you need to find a way to address the stress, because believe me, these positive changes will create stress. Imagine changing your habits, things you used to do for 30, 50 years. That's not that easy, right? So then you need to find a way to resolve these negative issues, the stress that might come upon you. So as you say, find a buddy. Find maybe a group. Studies have shown that people who live in a community, people who have a faith group, tend to be healthier. So find a health group, find a faith community, and that is going to help you. You know, in my country, Jamaica, they say, there's a saying that say, show me your friends, and I'll tell you who you are. So if you want to live a healthy life, and you want to change your lifestyle, you need to gravitate to people who are thinking like yourself, right? Because if you don't gravitate to a healthier group or positive people, then it's going to be very hard to make the change. Correct?
That's for sure.
All right, Dr. Bryce. So I had a patient. You know, I have a lot of patients. I've seen thousands of patients like yourself. So the patient, He has a history of hypertension, diabetes. He also was overweight. He used a cane because of his arthritis. He came into me for counsel on how to change his lifestyle. And I just couldn't get him to get the sugars controlled. So he came to me a couple of weeks after and he said, "Hey, Dr. Cooper, my sugars are controlled." I said, "What did you do?" You know what he said? "Well, I picked up my Bible and I began reading. You know, studies have shown that people who pray, people who meditate, people who visit a faith community tend to have less chronic diseases."
Right.
True or false?
Yes.
What are your thoughts on that?
There's what I call a stress-resistant personality.
I love that.
And we're dealing with high values of cortisol release from stress, adrenaline, norepinephrine, and all of these stress enzymes. And once you start getting a situation where you trust God, where you believe that He is going to direct your pathways,
Where you have hope.
where you have hope. Hope is very important.
Right.
And where you forgive.
Yes.
I remember telling a friend of mine, you need to write a letter to your dead father. I don't know where you're going to mail it, but you need to write a letter to your dead father and forgive him.
That's right.
Not until you forgive him will we be able to address your blood pressure. I'll be able to give you a lot of medicines, and it will bring down your blood pressure to normal, but your hypertension, which is due to your brokenness, the unforgiven spirit, that needs to be addressed. So you need to get behind these issues to help people.
Get to the cause.
You need to get to the cause.
And you did mention adrenaline and cortisol. These are the stress hormone. When your body is in a state of fight or flight, these hormones are elevated normally to assist you to control the situation.
Right.
But when these hormones are elevated chronically, then there is a problem. High blood pressure, high sugar, joint pain, tachycardia, and even death. So we need to find a place where we can actually relax, turn it off, time out, shut it down. That's the only way we're going to have complete wellness. Hi, I'm Dr. Cooper Dockery with Cooper Wellness Center and Get Healthy with Dr. Cooper. I want to welcome you to my YouTube channel where I'll be giving you information on how you can beat Big Pharma by taking control of your health. A lot of people think that diseases are not preventable, but you know, I have information that I've used with my patient over 27 years. I've helped this patient reverse their diseases, get off medication, and are living healthier without medication or with less medication. I want you to subscribe to my channel, give me a thumbs up, share the information with others. Keep watching every week because every week we'll have something new for you. And I'd like you to tell your friends about this channel, a channel that will save your life. So, welcome again to my YouTube channel. Click subscribe, click like, and leave your comments, and I'll see you again soon.